Great. Thank you so much, Tania. It's really great to hear about the work you're doing at Interior Health. So I'd like to welcome our next speaker, who's Tania O'Connor, who's going to share similar to what Tania just did in terms of what is happening at Ottawa Public Health. Before Tania comes on the line, I just want to mention that one of the things which we as NCCDH is doing through this initiative is that we have a direct connection to each site. So my colleague Tania O'Connor is on the line, and she's closely connected to Ottawa Public Health. And I have been having great conversations with Sana and her team, and prior to that, a former colleague was connected to Sana and her team. So Tania, on to you.
Great, thank you. So I'm Tania O'Connor, a public health nurse with Ottawa Public Health, and I'll be speaking to you about our project supporting the NCCDH's Organizational Capacity for Health Equity project. Before I begin, I would like to honor the Algonquin and Anishinaabe people on whose traditional unceded territory the City of Ottawa is located. I would like to extend this respect to all First Nations, Inuit, and Métis peoples, their ancestors, their elders, and their valuable past and present contributions to this land. So as part of our collaboration with the NCCDH, we have an OPH, or Ottawa Public Health project team, who are helping us direct this work. Our project team has experience working with priority populations in the sexual health program, equity-focused population health, and community engagement with diverse populations. This varied experience and perspective has been useful in our project discussions, and having an Ottawa Public Health senior leadership champion has been helpful to highlight the importance of this work and champion it within the organization. Diane Oikel is our NCCDH Knowledge Translation Specialist, and I'd like to thank her for her support and guidance in helping to prepare these slides. There are several strong drivers contributing to our efforts for a more formal approach to client engagement. In Ontario, the public health standards define mandatory programs and services public health units must deliver. They emphasize the need for meaningful engagement with priority populations and Indigenous communities. Engagement findings should be a source of evidence to inform evidence-informed decision-making, and a culture of quality and continuous self-improvement includes the measurement of client, community partner, and stakeholder experience. The standards also emphasize basing programs on community needs and priorities. Ottawa Public Health sought accreditation with Accreditation Canada in 2016, and key learnings from this third-party review helped inform the development of a quality improvement plan, and one of the focus areas, population health, equity, and client experience, around engaging communities and adopting a client-centric approach. We want to enable clients to have a strong voice in the planning, delivery, and improvement in services throughout OPH. So we'll be seeking accreditation again in 2020, and the revised Accreditation Canada standards consistently emphasize the need for client input and engagement in all aspects of our work. Engagement is also embedded in the Ottawa Public Health 2015-2018 strategic plan. A new strategic plan is currently under development, and again, engagement will be highlighted in the principles that guide our work. We also have an Ottawa Public Health client satisfaction policy that's been in existence since 2013, but now there's more desire to move beyond satisfaction to more meaningful engagement. To guide the implementation of our project, a project plan was developed to outline what we want to achieve and how we plan on getting there. Input from Diane was helpful in ensuring a health equity perspective was embedded within the project plan. The work plan has been helpful to inform our next steps, and it's been useful to refer to as a reference point to ensure we stay true to the intent of our project. The work plan is discussed with the OPH project team and Diane during our monthly touchdown support meetings. In some ways, it feels like the project has been a bit slow to get off the ground, and I think it's due to a few factors. We've had a lot of discussion around terminology. The most in-depth have been around the terms client and community. Which terms should we be using? Sometimes our client is a community that we are working with or providing service to. Staff see clients as those they are working with, whether they're an individual client, family, business operator, partner, or stakeholder. So I do anticipate that these discussions will continue. The term priority populations is used at OPH because this is terminology found in the Ontario Public Health Standards, and we want to be consistent with the standards that direct our work. A needs assessment with Ottawa Public Health teams and facilitated discussions with our leadership tables let us know that we needed to define engagement. In order to do this, we reviewed definitions from a literature search and like one from the Nova Scotia Health Authority. The feedback was that this definition had a community feel, it was broad, highlights trust-based relationships, and demonstrates that engagement is long-term. We're working to modify this to include how we define our clients and to ensure equity is reflected. When we talk about engagement, we want to ensure it's meaningful engagement, and this has also led to discussions about what meaningful engagement means and what it looks like in practice, and how can we measure it. Sorry, just one more point here. Some challenges for us have been the departure of 2 OPH project team members who were acting as project leaders and the departure of our management champion. While the delays were somewhat frustrating, movement of staff is something we cannot control. However, I would like to say because there is leadership commitment to this project, the work has continued. So in terms of going forward, aside from our OPH project team, who's collaborating with the NCCDH, we also have a cross-departmental, multidisciplinary work group who are helping advance this project. Their aim is to support the development and implementation of an Ottawa Public Health client engagement strategy that will assist our staff and teams to consistently, efficiently, and effectively engage clients, including priority populations, through the use of tools, examples, best practices, success stories, measures, and related pieces of information. We are seeing this as a one-stop shop for employees. We don't really feel the need to start from scratch as a lot of good work is available to guide us. Our work group is currently examining 2 local resources that are currently in use. We're looking at what is useful, what needs refreshing, incorporating examples of engagement that's already being done, and emphasizing the engagement of priority populations. We know there's great work happening within our organization, and we want to be able to share that. We are very fortunate to have a program and planning evaluation officer who's supporting the evaluation component of our project. So work on this initiative is ongoing, and I look forward to providing you with updates.
Great. Thank you so much for that, Tania. I think it's great to hear what's going on at Ottawa Public Health and to hear about some of the conversations you have on the ground there. So when you talk about terminology, it's really resonating with some of those comments we've heard about the importance of developing a shared understanding to actually guide the work.